Now for this next portion, we're going to talk about the structures that hold the lungs within the chest cavity, and that's called the pleura. The pleura is just two layers of simple squamous epithelium, really, really thin tissue with a little cavity in between it. The outer surface is called the parietal pleura. That's attached to the thoracic wall or the rib cage. The inner surface is called the visceral pleura. That's here. And then the pleural cavity is between those two layers. And there's a really thin layer of fluid that holds those two layers together. Now stay tuned for my next video. I'm actually going to demonstrate how this works. But essentially that layer of fluid holds the two layers of the pleura together and allows them to move past each other smoothly as the lungs expand and contract. This is important because the lung tissue itself doesn't do anything to push themselves open. They can't push themselves open. They have to be pulled open. And you remember we learned all of those muscles of the ribs and the diaphragm that help to increase the volume of the thoracic cavity. And that in turn inflates the lungs. That makes the lungs bigger, which pulls air into the lungs. And then contraction of those muscles decreases the size of the thoracic cavity, increases the pressure inside the thoracic cavity and the lungs, and pushes the air out of the lungs. So the way this all actually happens is that this parietal pleura is attached to the rib cage. The visceral pleura, is attached to the lung tissue itself. And because this layer of fluid holds those two pleura together, when the rib cage expands, the lung goes with it. Okay, so the surface tension in between the water molecules within the pleural cavity hold that together and pull the lungs with the wall of the thoracic cavity, which is fine unless somebody puts a hole in it. If you put a hole in the pleural cavity, then air can get into the pleural cavity. That is going to interrupt the connection between those two layers of the pleura. That's called a pneumothorax or a collapsed lung. What's going to happen is the thoracic wall is still going to be able to expand. The diaphragm is still going to contract. It's going to pull on that parietal pleura, but the visceral pleura isn't attached anymore because the only thing holding them together was the cohesion or the attraction between the water molecules. Once you put air in there, that's going to break up that cohesion. The visceral pleura doesn't follow the parietal pleura, and the lung stays contracted or collapsed. You can feel like you're breathing, working really hard to expand that thoracic cavity and pull air into your lungs, but nothing's happening because the lungs themselves are not going to expand. That's why a pneumothorax hurts so bad. So do yourself a favor, try not to get stabbed in the chest.